We are going to get ready for takeoff. Buckle up the seatbelts. My name is Dr. Mullins. I am happy to serve as your host for today's session. I am going to make a brief presentation, and then the next voice that you hear will be that of our presenters today. Also, let us know how you're doing in the chat box. How's your day been so far? So again, welcome to Face to Face, a series of virtual supports for CPS parents during the COVID-19 health crises. As our district continues to navigate through COVID-19 health crises, we want our families and students to know that we are here to support them. Can everyone see my screen? I did not do a check. Can you see that, the deck?
Yes.
Thank you. Okay.
I see it.
Thank you so much. And also, I have my colleague, Linda Washington, who will be assisting in the chat box on today's session. So our Family and Community Engagement in Education has launched a series of virtual workshops to help families navigate this new normal. Virtual offerings will be curated by experts and include various topics in the following areas as listed here. We want you to register so that you can receive information on future programming. We do have some instructions for today's session. Please go ahead and mute your mic if you have not had the opportunity to do so. We also ask that you be respectful with your comments. If you have questions, feel free to ask them in the chat box, and we will allow for time at the end for those questions to be answered if you do not want to type them into the chat box. We do ask that you be brief when sharing. So at the bottom of the screen is the microphone for you to mute your microphone. If you need to leave the meeting, you can go ahead and select that telephone icon in the center. And then there's that video icon, which you can turn off. And so all of our sessions are recorded. Why? Well, we want to share this knowledge with parents who were unable to attend. If you wish for your image not to appear, please click on the video icon. Otherwise, your image will appear on screen when you speak. If you do not consent to be part of the recording, you may end the video call and wait until the session is available on YouTube, which we will put that information into the chat box. If you stay, we will assume you consent to the recording. We will inform you when we start and when we stop recording. This is a new environment for us all, so if you make a mistake by accidentally selecting the present button, the screen is going to look like this, okay? But not to worry, you can stop presenting by selecting or clicking on the stop presenting button. Here is a preview of the remaining programs that we have for the week. And we do hope that you can continue to join us and spread the word about our future sessions. For more information about programming, you can send us an email or you can reach out to Norma Celadona. All her information is here. And remember, we want you to register for future sessions, and we want you to complete a survey from today's session to let us know how we did today. Now I'd like to cue recording. And again, good afternoon and welcome to the face-to-face virtual classroom. Our sessions are designed with you in mind to support your child's learning trends and to offer a variety of programs that help to build your knowledge and growth around various topics. We offer weekly classes, which are hosted live, recorded, and then uploaded to our CPS YouTube channel for future reference. We hope you enjoy today's session, which is part of our Adolescent Health Series Part 2, Substance Use Prevention, Cannabis, okay? So for more information on future programming, please visit our website at cpsparentu.org. And we thank you for attending today's session. Now I'd like to introduce to you our presenters for today. So we have Chi and Neil. So Chi is a health educator and AmeriCorps service member at Lurie's Children's Hospital of Chicago. She has a background in sexual and reproductive health care and education, and is passionate about working with young people to help connect them with these services. She also is responsible for creating and facilitating workshops around substance use for youth and adults. She is excited about starting nursing school next year and her recent certification to teach yoga. That's your first presenter. The next presenter we have is Neil. Neil is a health educator and AmeriCorps service member at Lurie's Children's Hospital of Chicago. He graduated from Northwestern University in 2019 with a degree in gender and sexuality studies. Neil has a focus on healthcare for queer folks and health justice. He's also a big fan of science fiction. So without further ado, I'm going to stop presenting and hand it over to our presenters today. And participants, go ahead and unbuckle those seatbelts. We have reached a nice cruise control, and you are in the hands of the presenters. Thank you so much.
All right, thank you so much. She and I are really excited to be back for day 2 or session 2 of this series. I'll go ahead and share my screen and we can dive in. All right, can everybody see my screen?
Yes, yes.
Yes.
Fantastic. Throughout the session, if you have any questions, feel free to drop it in the chat. Either Chi and I will answer either in the chat, or we'll take a second to pause. We also pause several times throughout the presentation to give you an opportunity to ask any questions. All right, so again, my name is Neil. I use he, him pronouns. And we'll get started with the workshop objectives. So by the end of our time here today, we'll hopefully all learn a little bit about how cannabis affects the brain and the body, and explain how the body is affected by different methods of cannabis use, for example, smoking versus edibles. We'll discuss reasons why folks might choose to use cannabis, and we'll also think about reasons folks might choose not to use. And then we'll also think about ways to reduce cannabis-related harm. And then finally, we'll provide some tips about when talking to your young people about cannabis use and substances in general. We'll talk about some resources and CPS guidelines as well. So before we jump into all of that, we want to make a note of our different identities, experiences, and backgrounds, and how that can inform the way that we interact with the world and the world interacts with us. We want all of our differences to be sources of strength, and to be respectful of that. It's also important to note that when we are talking about any substance, a lot of us have different relationships with a given substance, including cannabis. And so whether that is a personal relationship or maybe somebody in your family or close circles uses, we want to be respectful of those different feelings that can bring up, and different experiences. So we have some ground rules or safer space tips so that we can all engage in this conversation today in a way that feels safe and productive. The first one mic. So basically only one person is speaking at a time. I think all of you are muted, and thank you for that. It's really easy on this virtual format to accidentally cut somebody off. So we're gonna ask one person speaks at a time. We want to make sure we're using I statements, so speaking from our own experience and the ways and the things that we're thinking about instead of assuming what somebody else is experiencing or thinking. We want to be kind to one another. Please ask any questions that you have. That's why Chi and I are here with you today to answer any questions that you have. So no such thing as a bad question. And again, feel free to ask those questions in the chat and we'll have places to ask throughout the presentation. We're going to ask you to keep it general if you share any stories. So maybe you have a question or a situation that's come up with a young person in your life. Try not to give any identifying information. Try and like keep it to language like I know somebody who, or there's a young person who I work with who, instead of any names or anything like that. In a similar vein, we want to respect privacy. So what's said here stays here, what's learned here leaves here. So if you learn something related to cannabis use and reducing cannabis related harm, please feel free to take that out of this call and use it in your life. But if you learn a personal story about somebody, please just leave that within this space. And finally, we want to make sure that we are taking care of ourselves as needed. So feel free to turn off your camera if you need to take a break, get water, or whatever you need to do to feel safe and able to engage with us today. Awesome. So we'll just dive in with what is cannabis. So cannabis is a plant. You might also hear it referred to as marijuana or weed. Throughout this presentation, you'll hear Chi and me use the word cannabis instead. There are a few reasons for that. One of the reasons is that's what you'll find usually in scientific literature, and we want to make sure that we're leaning on evidence and research as much as possible. And then also the word marijuana in particular has a pretty racist history, and we want to make sure that we are avoiding reproducing that harm. THC is the main chemical ingredient that's psychoactive in cannabis, so that's that ingredient that people report getting high because of. Chemical compounds in cannabis are referred to as cannabinoids in general, so CBD is also something else that's in cannabis, but that does not have psychoactive properties. Concentrations of THC, so that psychoactive compound, has increased significantly since the 1960s and even the 90s. So the types of cannabis that you can buy today are a lot more potent. They have a lot more THC in them. So for example, THC content in the 90s was around 2%. And then throughout that decade, it grew to 4%. And then now, if you go to a dispensary in Colorado, for example, you can buy things with THC content between 17 and 28%. And then also when we're talking about cannabis and the ways that cannabis is regulated and policed in the United States, we need to talk about how racism has played into that and how political factors have as well. And so we'll get into that in this next slide. So this is a quote from the book, The End of Policing by Alex Vitale, which basically says, while there is clear evidence that drug use and dealing are evenly distributed across race lines, most drug enforcement happens in communities of color and poor white rural areas. When a white person is caught with drugs, they're much more likely to receive probation or treatment than non-white defendants. So this quote is getting at how race, income, and access can overlap to result in unjust control and policing and destruction of communities. Certain substances, including cannabis, have been weaponized historically to destabilize different communities, particularly Black communities and the anti-war left, which this book actually goes into a little bit more in depth if you're curious. Drug policy hasn't always been this punitive and harsh. It got particularly more focused on imprisonment and things like that during the Nixon, Reagan, and Clinton presidencies. So that's just something to keep in mind, that it hasn't always been like this and it doesn't always have to be like this. And we'll talk more about this concept that I'm about to mention a few slides in, but harm reduction is a way to address some of this racist violence that the war on drug has caused. And we'll talk more about harm reduction and how we incorporate that into talking with our young people. So speaking of the unjust and racist ways that cannabis use has been enacted on people in the United States, you can see here that for for folks ages 12 and above, cannabis use has been more or less the same over lifetime in the past year and in the past month. So there isn't a big difference when we're talking about who is using cannabis. But when we start to talk about, and this is from a report by the ACLU, but then when we start to talk about how policing looks and how arrest rates look, you start to see a really big difference in who gets policed and arrested for cannabis use or possession. In this case, it's possession. So you can see from 2010 to 2018, the white arrest rate was pretty low, 200 folks for about 100,000 people. But the Black arrest rate is several times higher. All right. Once again, if you have any questions, feel free to drop those in the chat and we'll keep chugging along. So what is cannabis? You might have heard some of these terms. So indica or indica is often said to feel relaxing or sedating. Sativa, energizing and uplifting, and then there are also hybrid strains, which combine both of these in various ratios. And so people might report feeling different effects based on the strain they're using. So these are some effects that people might report feeling if they use cannabis. They might report liking increased feelings of relaxation and calm, increased creativity. It can encourage appetite in patients who are living with cancer, HIV, and it might also help treat pain, or it can also help treat pain. And so those last two in particular are some of the reasons why a healthcare provider might recommend someone to use cannabis or might prescribe it. So that's just to reiterate that cannabis does have medicinal properties. People who use cannabis might also report downsides, such as longer response time or feeling easily distracted, which is especially important to note if somebody is driving. I think we've all heard like don't drink and drive very frequently, but using cannabis can also cause like delayed reaction time and things like that, which can lead to accidents and when someone is driving. They might also report feeling nauseated. They might report mild hallucinations or paranoia at higher doses. It can also cause impaired short-term memory, increased heart rate, sleep problems, or uncomfortable highs and panic. So if somebody is thinking about using cannabis, here are some things to think about. How strong is it? So potency, how much THC is in it? What's in it? So there is something called synthetic cannabis that is often sold as cannabis, which we have seen can cause shortness of breath and even death. Is it legal? So if you're in Illinois, it's only legal over the age of 21, and it's still illegal on the federal level. So that federal illegality can affect financial aid, employment, and it can affect undocumented folks. I mentioned driving already. And then what about the brain? So we have seen that the human brain does not stop developing until 25, the age of 25, and we've seen that cannabis use can affect brain development in young people. So here we have Chicago community area reports. So this link is included in the slideshow, which we can send out. I'm not going to click it here, but Chi, do you want to talk a little bit about what's included in these area reports?
Yeah, and I can also post the link in the chat. So this is just cool. So this is from the Illinois Youth Survey. So it just has some information about what youth are doing in different neighborhoods in Chicago. So it's like, for example, you can look at the Austin neighborhood, Belmont Cragen. So it gives you an option of different neighborhoods you can look at, and just has different rates of what students are doing, whether that be alcohol use, cannabis use. And I think in some sections it splits it up by grade as well. So yeah, we won't go through it now, but I can drop the link in the chat just so if you're interested, you can look through it. And again, we'll show you these presentations as well. You'll have access to them.
Awesome, thanks, Chi. So up next, we have a question we want to ask all of you. Feel free to answer in the chat. Why do you think youth use cannabis? I'll just pause here for a second. Yeah, I see friends use it or peer pressure. Anxiety. And depression, yeah. We'll talk a little bit more about it, but we have seen links between substance use and mental health. Yeah, bullying too. To feel better, that's what they're taught, excuse me. Yeah, a lot of youth, when we have these sessions, to report that people use it to deal with stress, and we've also seen in like different reports and things like that. That's a reason that people use substances in general. Yeah, peer pressure, difficulty expressing feelings. Yeah, absolutely, and we'll talk more about a lot of these as we move forward. Awesome. So here's, speaking of which, here it is, mental health and cannabis use. So numerous studies indicate that cannabis is commonly used as a stress coping strategy. One second. Yeah, and so then we also see a connection between what's called minority stress and cannabis use. So the discrimination and stigma that people can face depending on their own identities, the stress that comes with that can lead people to turn to substance use to cope with it. So we've seen in Black men, findings indicate that Black men who experience any major discrimination had an increased odds of using cannabis in the past 12 months. And then for lesbian, gay, bisexual, trans, queer, or questioning youth, bullying, harassment, and experiencing homelessness among young queer folks is also linked to increased substance use. So someone in the chat earlier mentioned bullying, and so we've seen that as well. So then high potency cannabis, or things that have a lot of THC in them, have been linked to the development of anxiety disorders. And in the slideshow, when it's sent out, you can see links to all of this information in the notes. And then there's also we've seen links between cannabis use and psychiatric disorders and those with a pre-existing genetic condition or other vulnerabilities. So here we talk a little bit about the different methods of using cannabis that you might see. I think the most common one is smoking. So that's where you're combusting the cannabis. There's also dabbing, in which the THC is basically put into an oil. Vaping, edibles, so it's eaten. And we have a video on the next slide that talks a little bit about the difference between edibles and smoking, which I think are some of the most common ways to consume cannabis. Then there are topicals, so moisturizers and things like that with THC. People don't usually use those to get high, but instead it's used to manage like pain or things like that. And then tinctures, so things you can drink. So here we have a video that talks about the difference between smoking and edibles. I will say the person speaks very fast and there's a lot of scientific terminology in it, but we'll talk a little bit about the main takeaways, which you can also read right there on the slide.
As marijuana becomes legalized throughout North America, many are trying edibles for the first time as a healthier option. But with edible marijuana providing such a different experience than smoking, how does it work, and is eating pot actually better for you? When you heat cannabis, you effectively change the chemical makeup of compounds within it called cannabinoids. Smoking heats it to around 800 degrees Celsius and converts THCA to delta-9 THC, which binds to receptors in your brain, making them continually fire and causing your imagination, thoughts, and perceptions to magnify. This is why every thought can feel like a significant one. And because it travels straight from your lungs into the bloodstream and to your brain, the drug works within minutes and lasts about 2 to 3 hours. But when making edibles, edibles, the weed is heated to around 150 degrees Celsius, burning less of the actual plant and minimizing carcinogens. THC is lipophilic, not water-soluble, so the activated THC must be dissolved into something fatty like oil or butter. And once this substance is consumed, the onset of the high is delayed as the drug is absorbed more slowly through your gut. But this high typically lasts 4 to 8 hours, and most report feeling more high than compared to smoking marijuana. This is because when you eat edible weed, the THC is first metabolized by the liver before entering the bloodstream, and here delta-9 THC also becomes 11-OH-THC, which passes the brain barrier more rapidly and is a more potent chemical. So using the same amount of marijuana, you actually get more high with edibles because it ends up creating both delta-9 THC and 11-OH-THC, which is a stronger compound. And because there are more psychotropic types of cannabinoids acting on your neurons, you'll be high for longer. Of course, you also get to skip out on the toxic chemicals that smoking provides, like carbon monoxide, bronchial irritants, and tumor initiators. Smoking anything means you're inhaling cancer-causing molecules, so if you can get high without smoking, it will be healthier for your lungs and body. The downside, it's much harder to control the high you'll get, because it can take up to 1 to 2 hours to feel the full effects, and the dosage can vary significantly. Modulating the effects, or titrating as it's called, is much more difficult, and as a result, you can end up a lot higher than you intended to. But unlike those who consume too much alcohol, opioids, or other drugs, you won't be suffering any serious long-term harm, toxicity, or lethal overdose if you do consume more than you intended. If you've ever wondered why marijuana gives you the munchies, check out our ASAP Thought video that breaks down the science behind that by clicking the screen or using the link in the description. And subscribe for more weekly science videos every Thursday.
All right, so yeah, a lot of information, speaks very quickly. But the main takeaways with edibles, you're not inhaling chemicals, so that tends to be better for your lungs and body. Edibles do take longer to take effect. So if somebody chooses to eat like a weed brownie or something, it can take up to 2 hours for that to take effect. And if they're like, I'm not feeling anything yet, I'm gonna eat more, they might end up eating more than they planned to, and end up feeling higher than they expected to. And then this is true no matter how you're consuming cannabis, but if you're underage, it's hard to determine the potency or content. So if you walk into a dispensary in Illinois, they're required to write pretty much exactly what's in there in terms of contents, of course, and then also like how much THC is in it. So if you're buying underage, you're not walking into a dispensary and doing that. So you might not know exactly what's in what you're buying. So at this point, I will turn it over to Chi. As always, if you have questions, feel free to put it in the chat box. I will be keeping an eye on it.
Hello, everyone. So again, my name is Chi. I just want to take a second because that was a lot of information. If anyone has any questions about anything we've discussed so far or anything that might be confusing before you move on.
Hi, this is Linda. I wanted to just share something with you. Can y'all hear me?
Yes.
Okay. When they first made marijuana legal, I was in Colorado, Denver, Colorado, and they had the big smoke out and all of that. But what made news was that a young man and his wife, they were sitting there eating the brownies, and they said that he said it was taking too long, which you discussed. It was taking too long. So he kept eating more and more because he didn't realize that it was going to take that long. And he ate so much that he got a gun and shot his wife. So that's one of that's something that when y'all mentioned that came to my mind, and it was it was bad. But she died. He killed her from eating all the brownies, trying to get high. Said it was taking too long. So just wanted to share that.
Yeah, thank you for sharing. So we'll talk a little bit about, we saw the video already, but we'll talk about that more, kind of a scenario we share with youth, about, why it really is important to, have this drug knowledge because, edibles do take a lot longer to take effect in the body. So definitely eating it can cause more of those unpleasant side effects, such as anxiety, and in some cases, paranoia. So again, I haven't heard of that situation. But again, ingesting a lot of THC can definitely bring about some of those unpleasant side effects. So I'll get into that. Are there any more, trying to look in the chat, any more questions that people have?
I'm not sure if this is a question or a comment, but someone said it's safe to use cannabis with a low THC level, or is it safe? Chi, if you have a response to that.
So we're gonna get into harm reduction now. So again, I think there's risks associated with anything. I don't know if I'd go so far to say that it's safe. I would say it is safer and it is a way to reduce harm, to not be ingesting, cannabis that has a high THC content. Because again, the more THC, that's the chemical that gets someone high, the more THC is in someone's body. They're getting more of that, high effect and high feeling. And we'll definitely get into like the idea of harm reduction and what that means in a little bit. Any other thoughts or questions? Okay, if you do, just drop them in the chat. Let me turn my camera on so we can move on. So now we just want to talk about strategies to promote safety with youth. So I think, something that we really try to focus on in our education sessions with adults and with youth is just the idea that, youth are using. So focusing on this idea of harm reduction instead of solely abstinence, and we'll talk about abstinence as well, but trying to incorporate this idea into this talk around substances as well. So what exactly is harm reduction? So I'm gonna turn that back to the audience here. So 2 questions. So what comes to mind when you hear the term harm reduction? You can come off mute or you can drop that in the chat. And then if you're familiar with harm reduction, or even if you're not, what are some examples of harm reduction you can think of? So you can answer one of those questions, you can answer both of them. Again, you can answer them in the chat or you can come off mute. And I see the question in the chat. So is there edible cannabis THC to help people with sleep issues? Is this harmful or addictive? I will say if someone is having, sleep issues, insomnia, it's definitely a good idea to talk with their doctor about what, sort of interventions can be used. Cannabis isn't harmful 100% of the time. It is something that doctors prescribe. But again, if you are using it to treat a certain condition, like some people will use this to treat a certain mental health condition if they have anxiety or help with sleep, but it's best to, talk to a doctor about how you can use it to help whatever issues you have, because there might be, a better something that works better for your body, or maybe in that case, your doctor will decide, cannabis is what works best for this person in this situation. So I would definitely, if someone has a specific concern around their health, definitely talking to your doctor. And thank you for that. And Lindsay is one of our clinical social workers at Lurie Children's Hospital, so she can also help provide that clinical perspective as well, if you'll have specific questions. So I'm going to throw out an example. So what do we think of when we think of harm reduction? So something that comes to mind for me is like sunscreen. So we use sunscreen to protect from, getting sunburn, to protect from skin cancer. So sunscreen can help with that. If we're thinking of, seat belts, driving poses a risk. So we use seat belts in case we get in an accident to, lower the chances of harm to our bodies. So with this idea of like what harm reduction is, those two examples I gave y'all, can we think of any other ones? If we think specifically of like COVID, certain things we use to reduce harm in this time. Awesome. So yeah, masks. So a lot of people got that one. We use masks, gloves, face shields, washing hands, definitely things we do to reduce harm. Some other things in terms of like sexual health, condoms, maybe taking a taxi home if someone has been drinking instead of driving. These are all things that people do to reduce harm from certain activities. And getting into a more explicit definition of what exactly harm reduction means, this term I keep saying. So harm reduction, it incorporates a wide variety of strategies that people can use. So whether that be, safer use if they're, in the subject of substances, if they're using substances, managed use, abstinence, meeting people who use drugs where they're at, and it's addressing conditions of use along with the use itself. So that idea being, okay, if someone is using cannabis, instead of just saying like stop using cannabis, let's try and figure out, okay, why are they using cannabis? Are they using cannabis because they are stressed, because they are going through a lot? So let's try to deal with that aspect too, instead of saying immediately like don't use this drug, it's bad for you. Let's address other conditions that may come along with that use. So here, does not minimize or ignore harms that are associated with substance use. I think that is something that we want to be really clear, especially when working with youth, that like, these substances can cause harm. Like these are all the facts around it. But also just trying to be realistic, especially when we look at data of, teen use, especially in Chicago, in Illinois, looking at that Illinois youth survey. Trying to meet youth where they're at, instead of just saying, don't use it all, and I'm not going to give you any more information about this, trying to meet youth where they're at. And then it applies evidence-based interventions to reduce harmful consequences of behavior. So again, using research and data, what are things we can do to help incorporate these strategies? Really quickly, just looking at the slide, I'm not going to read everything on the next slide, but why are we doing harm reduction? It can help reduce death for one. It keeps folks engaged. So if people are using substances and we're just saying right away, like, don't do this, that kind of might completely turn them off to the conversation. Instead of saying like, hey, why are you using? Like, maybe let's incorporate other strategies so you're not using as much. It can also help youth help their friends. So for a lot of times, if we're just telling youth don't do this, it's like, okay, what if they're in a situation where they need to help someone, their friend's in trouble, and they don't exactly know how to help or what advice to give. And again, we will send you these slides just to be aware of time, so you can read through this on your own as well. Also, just a really important aspect of this idea of harm reduction, it reduces stigma. So again, we're not saying drugs are bad, don't do them, because that can, really create stigma around it. So if people are using drugs, they may be afraid to seek care because they're afraid of how people might judge them. And then also stigma can also impact our actions and policies. And impacts communities. So when Neil showed before the data about, arrest rates, looking at, white folk and Black folk and how there are, big disparities between arrest rates. So a lot of this stigma can harm our communities as well. So keeping in mind that video we watched, so when we are working with youth, again, the idea of harm reduction, it can help youth help their friends. So a scenario we give is the scenario, Neil, you can go to the next slide. So your friend Eddie tells you they had a weed brownie 15 minutes ago, they don't feel anything and want to eat another one. So we pose this question to youth, what information and advice would you give them to reduce possible harm? So letting that friend know that it takes longer for edibles to kick in, up to 2 hours, and not to eat another one, to try and avoid those negative side effects that can come with a lot of THC in the system. Looking at some more strategies. So, obviously primary prevention is the safest route. So delaying or avoiding use. So, encouraging abstinence, especially if engaging in sexual activity. And then also delaying use is a good option as well. Again, the brain is still developing up until 25. So at 21, people can, legally go to a dispensary and be more aware of, okay, exactly how much THC is in this product, be more aware that there are other harmful chemicals in those products. So just be more knowledgeable of what you're putting into your body when you can legally buy. I kind of talked about this already, just developing a drug knowledge. So really important just that we're talking with youth so they know the basic effects, risk, and benefits of certain substances so they can make healthy decisions for themselves and their lives. So just, not talking about it with our youth doesn't help them to be informed. So we really want youth to be informed so they can make knowledgeable decisions about what's right for them. And then knowing drug policies. So, you can go to the next slide. So this is just a map which needs to be updated after this recent election. Some things have changed, but in Illinois, cannabis is legal for medical and recreational use. But in other states it may not be legal. So just having youth know like where they go, knowing the laws around cannabis use. And again, only legal for adults over 21 throughout the United States. And then also talking about drug policy. So I think this is really important when we think of, CPS policy. And I know CPS has changed some of their policies. There were some discrepancies in the House. Students were, punished in terms of if they came to school under the influence of alcohol versus under the influence of cannabis. So I know they changed the policies to, have the same kind of punishments or actions regarding those two substances. But it's really important for youth to know like what are the policies in their schools and making sure those school policies and just us as a community, we're fighting to make sure these school policies are fair and don't unjustly, target youth and aren't unnecessarily punitive. And then develop other strategies for stress relief. So like we mentioned before, a lot of youth may turn to cannabis because they are experiencing stress. So again, instead of completely saying, okay, stop using, saying, hey, what are some other things we can do that we can turn to when we're stressed? So maybe that's, doing yoga. We've done meditation videos in some of our workshops, which some of the youth really like. Coloring, running, video games, whatever it is that youth can do to de-stress without turning to substances. That's another strategy they have in their toolbox to turn to when they are feeling stressed or when they are having anxiety about something. And then this is just a quick summary of what I've talked about. Are there any questions here? I'm going to go into the last part before questions, just tips for talking to youth. But any questions? I know I spoke a lot and haven't had a chance to look at the chat. Okay, awesome. If there are questions, definitely feel free to interrupt me or put them in the chat box. So just tips for talking to youth about cannabis use. So these are the same ones we looked at last week, but if folks weren't here, just going over them again. So starting by asking more general questions. So maybe not asking, have you done this substance before, but kind of asking, hey, like, do kids at school use cannabis? Or asking them what they know about the substance, what they think they know about the substance, just kind of trying to get general knowledge of what they're trying to get an idea of what their knowledge is around cannabis. Trying to keep an open mind. Put yourself in the young person in your young person's shoes. Be clear about your goals. So I talked a lot about harm reduction, but it's okay to say to have specific goals for your house. I would like you to not use substances. Is definitely a fine goal to have, and just making sure we're setting those make sure you know what those goals are for your household. Be calm and relaxed. Be positive. Try not to lecture. Again, try to have it be an open conversation where you feel like their voice is heard and they feel like they can come back to you and talk to you about this again. And it's not just a one-time conversation where they leave feeling defeated. Try to find a comfortable setting and just be aware of your body language. So even if we are, not saying anything with our words, our body language kind of might be maybe closed off and might not be open to having that conversation. Just be aware of what your body's doing. Are there any questions about tips? No? Okay. So what I do want to show, and again, you'll have access to this, just the resources. So there's a bunch of different resources in Chicago, as well as hotlines and websites you can go to. So if people do have questions, or maybe someone in their life, a youth in their life who that you are worried about their substance use. Lurie has a substance use program. There are also a couple other ones in the state as well. And there are a bunch of hotlines on here too. So you'll all have this information and these resources. The last thing I want to do, so I'm gonna open it up to questions. I want people to feel comfortable asking questions. So I'm going to pull up poll everywhere. So this way you can ask questions anonymously. So if you don't, want everyone to know who's asking what, you can ask them anonymously. So Neil, I can share my screen. Okay. Okay, so you can, and Neil, if you can put this in the chat, so you can go to the website pollev.com, or you can, pollev.com/okfern761, or you can text okfern761 to the number 37607. So whichever is easiest for you. And if you feel comfortable asking them, in the chat or off mute, that is fine as well. So whichever avenue you would like to use.
So I do not have young children, but I have a question that often concern me. How do we know when there is use and when there is abuse? Like, when should I be concerned as a parent?
If Lindsay, are you still in here? Do you want to take that question?
Yeah, that's fine.
Thank you.
Usually the things you want to look out for are behavior changes and any kind of changes in functioning. Are their academics kind of slipping? Are their priorities changing? Are they maybe hanging out with different people you're not so sure about? Also could be great people, not saying that that's a problem. So just kind of looking at anything that's kind of been changing. Have you noticed maybe they're not as engaged in some family activities? Again, these all could be behavioral issues that aren't related to substance use. But if they are using and admitting to substance use, or you are finding kind of signs and symptoms that things are being left around, but mainly you just kind of want to see if there's changes. Like they used to play basketball, now they're not going to play basketball anymore. Their academics maybe go from A's and B's to C's and D's. So just kind of those kind of changes are what you're going to look out for to see if it's going from use to kind of misuse, if that makes sense. Is that kind of clear?
Yes, thank you.
And then I see a question in the chat box as well. Are youth using cannabis more than cigarettes? So I'm not exactly sure the exact numbers when we compare the two. I know that, you know, in terms of nicotine and like vaping products, so vaping products, cannabis, and then alcohol are the three like most used in Illinois. I'm not exactly sure like how those two specifically though, cannabis and cigarettes compare.
Oh, I can comment if you want to. What I see, I guess, what I see with a lot of the adolescents I work with is there's more frequent vape use. So cigarettes are pretty rare among adolescents. Even just young adults don't really use much for cigarettes, but cannabis is kind of something that they're using more when they know they don't have to go home right away. They know they're not driving. So for the most part, I would say they're using vapes very frequently, like maybe anywhere from 4 to 10 times a day, whereas they could be using cannabis, I don't know, 5 to 1 time a day. So, I mean, they're both used frequently, but I would say that vape usage is much more frequent than cannabis use because the cannabis high is lasting so much longer. And so they can be high for anywhere from an hour to 4 hours versus just hitting their vape. And that literally lasts maybe a minute. And so they'll hit it again 10 minutes, 20 minutes, or an hour from then.
Thank you, Lindsay. And then I'll answer the question. I know there's a couple in the chat box. I'll answer the one in the poll everywhere. So isn't cannabis bought on the street dangerous? Could it be laced with other chemicals? I think it's just important to remember, again, if people are getting something off the street, you can't be sure really what's in it. At least if someone is buying from a dispensary, you can be a little bit more aware. Usually when you get something in a dispensary, it'll like have a label on it of at least like how much THC content that has. I know there was some issues with vaping products. So vaping products can have nicotine in them. They can also be cannabis vaping products that have THC. I know there are some issues with vaping products having vitamin E oil in it, and that led to a lot of hospitalizations related to those vapes. Whether it be nicotine or THC, both of them bought illicitly could have vitamin E oil in it. So that is something that's really important to keep in mind if people are buying products off the street. Then that, you know, there can be chemicals in there laced with other things. So that's why, you know, we really say, you know, delaying use is a good option if people are curious about cannabis because, you know, you can then legally go into a dispensary.
I see another question from the chat. Is it a good idea if someone who has bipolar depression to use cannabis, or would it help? So for that, I will say we don't have any recommendation. That is a question for a healthcare provider, especially if it's about the medicinal properties of cannabis. I know that's not super helpful in this moment, but
yeah, I would not say you would ever want to use cannabis as a prescription to manage your bipolar depression. And also just to keep in mind with bipolar that you also run the risk of psychosis. And as you guys might already know, that's one thing THC in the brain can kind of trigger is a psychosis episode, a psychotic episode. So it's just something to keep in mind that it might just put you at higher risk for further, I guess, mental health issues.
There's another question in the chat. Are doctors screening youth for smoking during annual appointments? So I actually don't know, Lindsay or G.
They're trying. They're trying to increase that happening. I know they're making a big push for it. Not all doctors are. I know they're trying to here at Lurie, but I think they're trying to make a bit more push for it. Depending on where you're going, depends on whether or not they're going to screen for that. And if they are, they're usually not doing it with the parents in the room.
I think that's more so like asking youth, and Lindsay, correct me if I'm wrong, like asking youth, have you, used substances before? Like, have you used alcohol before? And not like they're just doing a drug test without, the person's consent.
Yeah, absolutely. And then do all inhaled forms of cannabis have a potent smell? Absolutely not. Most people who are using a vape pen, it actually does not have a smell at all. And that's why a lot of teenagers love using those, because it's easily hidden because it's a small pen and there is no smell to it. So it does not smell like your typical marijuana.
Thanks. And then I actually haven't heard of wiki sticks before. So yeah, I'm not exactly sure what that is. I don't know if anyone else, or Lindsay, you've heard of that.
I mean, I think it's like a blunt. Yeah, so it's a blunt with embalming fluid. It's not healthy at all because we all know what embalming fluid is. So yeah, if you're hearing about that, I would probably say that's a huge red flag.
And for this other, I don't know. So
I would say there is an increased smell, because I think part of the allure for a lot of marijuana these days is to kind of have these fun names and smells and tastes. So when you are actually buying bud, it's supposed to come with like, oh, I don't know, I can't think of anything off, Maui Wowie. And so it's supposed to smell fun and fluorescent, whatever. So yeah, I would agree that some of them, they're going a little crazy with the way they smell and possibly taste.
Yes, and then for the next question, so yeah, any type of cannabis can be detected in a drug test. So if someone is using a vape, if they're like using rolling papers, whatever it is, if they're eating a brownie that has cannabis in it, that can be detected in a drug test, because those tests are looking for the chemical THC. So if any type of product has THC in it, I would assume, I'm not sure about like, the lotions. I'd assume with those two though, since those are, getting absorbed through your skin and into your bloodstream.
And for the one, if someone's smoking in your house, I'm going to say it's very uncommon. I know you would probably have to be in a really tiny room with them filling the entire place with smoke for you to actually ingest enough for you to get high. I think some people feel like they get a second-hand high, and I don't know if that's a placebo effect, but I think it's definitely possible. But I don't think people are getting high to the point where it's in their system, if that makes sense. I know people claim it, but I don't know about actual scientific evidence for it. Let's put it that way.
Okay. It is 5:02, so I do not want to keep people over. Again, if you have questions, we'll be back next week, so you can definitely hold on to those, or you can email, I guess, Norma, would they be able to reach out to you?
They can email me. Yes, I'll leave my contact information. I also pasted the emails of people who wanted copies of the presentation. I want to make sure that we didn't miss anybody.
Okay, and then I also don't know, we just have a survey from today's session if people could fill it out. I don't know if Neil, if you already posted it. No, okay, so I'm gonna post it. If you have a second, if you can fill that out, just so we can know how to improve on this presentation, that would be awesome. But that is it from us. Thank you so much, everyone who sat in today with us.
Okay, well, thank you, Chi and Neil, and for the additional support from Lurie today. We thank you so much for joining our session, and we're going to go ahead and close you out. So we hope that you enjoyed today's class, which is part of our Adolescent Health Series Part 2, Substance Use Prevention, Cannabis. Our classes are recorded, and you can find them on our YouTube channel. And we've dropped that information into the chat box. I know we have dropped a lot of information into the chat box, but you can visit our YouTube channel to review all of our recordings. And so we also want to do a plug for our cpsparentu.org website, which you can get more information. And don't forget to follow us on social media at CPS Parent U. We are on Facebook, we're on Twitter, and we are on Instagram. Don't forget to sign up to get news about our upcoming sessions, and let us know in the chat box, how did we do today? Can we see some 10s in the chat box? Did you learn something? Was this helpful? Would you like to see more of these sessions? Let us know how we did today. And we know that you have many choices when it comes to virtual sessions. We thank you so much for joining our session, and we are right at the gate. You can enjoy the rest of your evening, and we do look forward to seeing you next week for part 3. And just to remind everyone, if you attend all 3 sessions, you will receive a certificate. So we look forward to seeing you next week, and have a wonderful rest of the evening. We're getting some feedback, thank yous, and a 10. So thank you for your feedback. Have a great evening, and we look forward to seeing you again. Don't forget to fill out those surveys. We have 2 surveys for you all to complete. So thank you so much, and have a great evening. Bye.